I think the reality between most specialists who are well qualified, we're all very, very similar in what we do. But the difference is in being to be there to help the person understand and feel that you're there to support them is what the key difference is between different specialists. So I feel my role or my approach is being open up front, but also then to have you know that I'm there to give you the best advice and have your back when you need it. I'm Charley Zheng. I'm a fertility specialist, one of 4 in Sydney. I have been in the fertility industry for about 10 years now. I'm a qualified CREI specialist. Half the time I also go around delivering babies, so that's sort of a part of my job. I really enjoy my fertility work and love being part of the team together at Adora here. What I find most satisfying through the fertility journey with helping people is that fertility is such a special thing. It is a process where we're actually creating something. Very rare is in medicine that you're actually creating something out of nothing. Most times we're actually doing reparative work. So here we're actually helping people not only through their day-to-day issues, but also creating life. And so I think it's a wonderful process. My approach to patient care, I ask the patients first where they're sitting, what they would like to do, where they like to be. Because ultimately, my decisions should be revolved around what they would like to achieve. Of course, we can achieve that goal, that'd be wonderful. And sometimes I can't, I'm gonna try. And that's what the approach has been. I have a lot of interest in fertility, obviously, but the one area that really excites me is both being a fertility specialist and an obstetrician, because often there's a disconnect within fertility where you've got your fertility specialist and your obstetrician, but they don't talk to each other. But I find that as someone who's got a dual role, I have a deeper understanding of the whole process. And the most important part of the pregnancy is actually the early parts of pregnancy where you can make the biggest difference. So as a fertility specialist from the very beginning, we can see and predict a lot of issues later on. And I have a strong interest in seeing women in that area at that time to create the biggest difference in the whole pregnancy journey. There's a lot of things to expect at the first fertility consultation with a specialist. What we'll typically do is take a bit of the history of the patients, their journey so far, their medical and surgical histories. We will go through quite a few of the routine things that need to be done, like prenatal medications, various screening tests that needs to be done. We will peruse and have a look at all the information that we've already currently presented. And lastly, of course, we'll have a chance to go through any questions that they may have. We'll then lastly present all the various plans that is available and should be considered, and of course go through that one that's most suitable for them. Of course, we'll have a chance to actually come back and review if we need to, because we can't always come to a decision the very first time around. There's quite a lot of advice which I share with patients who are starting their journey, but I think the most important is to actually have a mental preparedness, have the certainty and understanding that we are there for you and we do care about where you are. We may seem busy, we may seem distant at times, but do trust me that our heart's in the right place for you, and please do reach out. We do really care about you. It is a tough process, it is a tough journey, but we're there to hold your hand.